My name is Dr. Harim Jafar Hamarashid. I'm periodontist. I'll continue my lectures on the influence of systemic condition on periodontium. We discussed the effect of endocrine disease like diabetes, hematological disorder like leukemia, neutropenia, agranulocytopenia. Today I'll discuss with you the effect of stress or psychology on the periodontal disease or the periodontium. Stress is defined as the response state of an organism to physical and mental forces that goes beyond the adaptive capacity, which lead to disease of adaptation and eventually to exhaustion. Stress is like a spice. In a right proportion, it enhances the flavor of the dish. Too little, it produces a bland, dull meal, and too much, it may choke you, and it may be deadly. Stress may be eustress. This is a term which means a positive way of stress, or distress, which is a negative way of stress. Acute, chronic, or a fight or flight action, which tend and be friend through oxytocin and estrogen. How stress affects our body? If we see this diagram, part of it, which is most of it, through research they prove that it's through the load of the work, and lesser than that is personal life, and time is an issue. It will take 50% of our stresses, and financial problems, which takes 10%, and the health problem, which is the least one, 9%. This is how stress affects the body. So it affects all of the body, especially skin, joint, muscles, heart, immune system, pancreas, stomach, oral cavity, and etc. So this is how stress can affect your body, or on which proportions. We have acute and chronic stress. We know that the acute is with short duration. You have fighting or running to survive. The levels return to normal in hour, and there's an elevation of blood sugar and fatty acids in the acute stress. Also, there's an aid in memory formation to remember the stressors in the future, and it enhances the immune system, enhance recovery from activity. Like for example, an acute stress, like when you do an examination. During examination, you have a stress, you have an acute stress, but this stress will help you to remember, to memorize things, to recover after that. While chronic stress has a long duration, and it increases chronically day by day throughout years, and there will be elevated blood sugar, fatty acids, and there will be a muscle catabolism, and can cause neuronal death and inhibits memory formation. It may affect your short or long memory duration, and may increase the chance of brain degeneration. And there will be an immune suppression, raising the chance for infection and recovery impaired up to twice as a normal one, or a patient or a person with acute stress. We have positive stress. There will be brief increase in heart rate, mild elevation in stress hormone levels. When you tolerate or tolerable stress, it's serious, but it's temporary stress and buffered by supportive relationships. While the toxic or deadly one is have prolonged activation of stress response system in the absence of protective relationships. Short-term stress. When the stress affecting the hypothalamus, it will affect on the adrenal medulla, and the adrenal medulla will secrete or enhance the secretion of epinephrine and norepinephrine, and this will enhance the adrenal gland to secrete cortisol. And the effect of epinephrine or norepinephrine are like that. The glycogen broken down to glucose, increasing blood glucose. There will be increased blood pressure, increasing breathing rate, and increasing metabolic rate, and change in blood flow pattern, leading to increased alertness and decreased digestive, excretory, and reproductive system activity. Fight or flight reaction. In this case, a heart rate increase, lung consumption of O2 increase, and spleen discharge for red and white blood cell will happen, and to lead to increased oxygen consumption. And the blood flow will increase by 300 to 400%. Adrenal act on B1 receptors, which in turn lead to heart beating faster and harder, increasing cardiac output. And the adrenal gland and the adrenaline act on alpha receptor of the blood vessels. It will lead to increased contraction of heart and increasing in the blood pressure. We should know the effects of sympathetic and parasympathetic on the whole body. The sympathetic affects, for example, the eyes, the salivary glands. Both of them are affecting the symptoms of the body, but in different ways. For example, the sympathetic dilate the pupil while the parasympathetic contract it. Sympathetic inhibits the flow of saliva while the parasympathetic stimulate the flow of saliva, and etc. It will affect all of the organs of the body. Effects on the brain. For example, if the hypothalamus increase in corticotrophin releasing hormone, this will act on the pituitary gland to release adrenocorticotropic hormone, and by this it will affect the adrenal gland on the kidney, which by in turn releasing cortisol to the immune system, and this will affect the hypothalamus. The increasing cortisol will affect the hypothalamus to be in a state of stress and affecting the whole body. While chronic stresses, in chronic stress, both autonomic nervous system and sympathetic and parasympathetic will be affected, and there will be increase in pro-inflammatory cytokines, which is very important for the oral cavities, and sympathetic overdrive decrease the heart rate, increase the blood pressure, increase the heart rate variability, and there will be oxidative imbalance, decreasing antioxidant defense, increasing free radicals, and increasing lipid oxidation. So as general, the chronic stress affecting badly on all of the organs, especially by increasing the pro-inflammatory cytokines, which will affect the body, especially cardiovascular systems, which may make the body prone to atherosclerosis, microvasculopathy, perfusion deficiency, and impaired tissue or organ functions. The effects on endocrine system. Uh, for example, the nervous system will secrete the neurotransmitters and cytokines. Also, the immune system will respond by secreting cytokines. When we have an anxiety, depression, and insomnia, the immune system, the brain will secrete neurotransmitter, which will enhance cytokines production, and also the immune system will respond by secreting special pro-inflammatory mediators and cytokines, producing pains and inflammatory infiltrates to be secreted inside the blood. And also the immune system by that will affect the endocrine system through secreting special cytokines. And these cytokines may affect specific types of hormones, which will affect the endocrine system. And this will affect the thyroid gland and the pancreas, which may lead, for example, increased blood glucose and make the patient prone to diabetic. Effect on oral cavity. The effect of stress on oral cavity is result from a psychic influence on the organic control of the tissue, which is known as psychosomatic disorders. And it will show itself in two ways: through the development of habits that are injurious to the periodontium. For example, a stressed one may have a bad habits. For example, nail biting, pencil bite, or grinding of the tooth in case of bruxism or clenching, or by the direct effect of the autonomic nervous system on the physiologic tissue balances through secreting cytokines and pro-inflammatory mediators like tumor necrosis factor, like prostaglandin, and etc., which will in turn leads to a periodontal destruction. The behavioral change that's caused by stress, including oral hygiene neglectance, change in dietary intake, parafunctional habits, and use of tobacco and its products. This is how stress affects the periodontium. When we have a stress through daily hassles, environmental influences, through major life events, psychological factors, systemic illnesses, it will affect, for example, on the autonomic nervous system, and this will affect on the adrenal medulla through secreting adrenocorticotropic hormone, or directly through secreting epinephrine and norepinephrine. This will lead to increase of blood glucose and altered immune response, and the altered immune response will affect the polymorphonucleus, especially neutrophils, which we talked about in the previous lecture. The deficiency of polymorphonucleus, or the impairment of this system, which is the first line of defense against the bacterial challenge inside the oral cavity. This will lead to increased susceptibility of periodontal disease. Or it will affect on the hypothalamus, which affecting the anterior pituitary and affecting the adrenal medulla, through which will affect the adrenal gland on the kidney by increasing cortisol, which cortisol by itself lead to suppressed inflammatory response and increased blood glucose level, and altered growth factor level, also altered cytokine level. And these impairments lead to increased susceptibility of periodontal disease. Also, stress through poor coping strategies, it will lead to health impairing behavior. This is one of the ways psychosomatic disorders, and this is the behavioral disorders. The behavioral disorders, including poor oral hygiene, when you feel sick and you are not sick, you just have a stress and you can't brush, you can't floss, and you don't have a mind to do good things because you feel unwell, or you do cigarette and alcohol consumption, and you may face insomnia and poor nutritional intake, and this will affect, of course, the increasing susceptibility to periodontal disease. Stress reduction protocol in dental office includes recognition of medical risks and anxiety, medical consultation, pre-medication like anxiety or sedatives, and etc. Appointment scheduling, minimizing waiting time to reduce anxiety, and vital sign monitoring like blood pressure, heart rate, and the rhythm of the heart and respiratory rate. Management by patient himself, including regular exercise, the benefits of medication and other relaxation techniques for 20 to 30 minutes. Strengthen your relationship. Learn better ways to manage time. Find better ways to cope. Take good care of yourself and get plenty of rest. Eat well. Don't smoke. Try out new ways of thinking. Work on letting go. Just let it go. Let the things go, things you can't change. Learn to say no. Don't say yes for everything. And speak up. Don't just be quiet. Don't put things inside yourself. Just speak up and be frankly. Ask for help. Everything will be okay. And this is the effect of psychology or the influence of systemic condition on the periodontium. Hope you like it, and hope to see you soon in the another lecture regarding the influence of systemic condition on the periodontium. Have a nice day.